For decades, scientists have been researching the role of metal-ion reactivity and uncovering the enzymatic reactions that play key roles in the formation of cancerous mutations and diseases like hemochromatosis. Many enzymes require a metal ion, such as zinc, copper, or iron, to carry out their functions. Metal enzymes activate and accelerate chemical reactions in the body essential to maintaining life and affect nearly every function, including metabolism, respiration, digestion, muscle and nerve function, and countless other vital activities on a cellular and molecular level. Hemochromatosis is a metabolic disorder that causes the body to absorb too much iron from the food we eat, leading to an abnormal accumulation and overload of iron in the organs. In the case of cancer, some enzymes are overactivated, leading to cellular propagation and uncontrolled and unregulated tumor cell growth. We believe that although metal reactivity is required for a eukaryotic organism to reach healthy maturity, beyond this stage, continued elevated and unregulated metal-induced enzymatic activity contributes to oxidation and inflammation. Iron and copper are cofactors for numerous enzymes essential to eukaryotic life. However, they can also react with molecular oxygen to generate reactive species that damage lipids, proteins, and the protective caps at the end of chromosomes called telomeres. Telomeres play an important role in regulating the proliferative potential of cells. As cofactors are both essential and potentially dangerous, their levels are strictly regulated. A disturbance in this balance can have downstream effects. For instance, in the copper-binding protein ceruloplasmin, which plays an essential role in iron homeostasis. Recent studies suggest current treatments such as copper chelation can lead to adverse effects not only on ceruloplasmin, but also on other proteins in the iron metabolism, including at the mRNA level and in inflammatory conditions involving the pro-inflammatory cytokine interleukin-6, IL-6. Telomir 1, an advanced metal enzyme inhibitor, is being developed to treat hemochromatosis and a broad range of cancers by selectively binding to metal ions in a dose-dependent manner, slowing enzyme reactivity, protecting and lengthening telomeres, and helping to reduce the development and spread of cancerous cells. Telomir 1 is a novel treatment that uniquely and selectively binds critical metals to interrupt enzyme function, returning cellular metals like iron, copper, and zinc to homeostasis, and turning off the underlying cause of cancer development and growth. By targeting specific classes of enzymes through its metal-binding properties, Telomir 1 is believed to selectively affect the key processes that drive the concentration and accumulation of iron and copper in the serum that affects diseases like hemochromatosis and cancer. Compared with traditional treatments, Telomir 1's effects on metal ions can be exploited against a wide spectrum of tumors with high efficacy and without drug resistance. Telomir 1 presents a bright ray of hope in the fight against hemochromatosis and cancer by targeting and chelating critical metals to interrupt and prevent the enzymatic actions that create the systemic imbalance of cellular metals that allows elevated reactive oxygen species to oxidize and erode the protective DNA telomere caps. We believe this will be the first non-toxic oral enzyme inhibitor regulating the overactivity of the enzymes caused by excessive metal reactivity. Telomir Pharmaceuticals, working to enable the body to heal itself.